The formation of a clot is good. When we are injured, we are bleeding and we need to achieve hemostasis, which is stopping the bleeding. Perfect. But when a clot forms within a blood vessel, it becomes catastrophic. And when you have these clots forming in the venous system, we have arteries and veins. In the venous system, then we get venous thromboembolism. Venous thromboembolism is divided into two. We have deep venous thrombosis, which occurs in the leg and the pelvic area, and pulmonary embolism, which occurs within the lung area. Most of the time, we get pulmonary embolisms as a result of a clot breaking off from the deep venous thrombosis. So deep venous thrombosis occurs when there's formation of a clot within the vessels of the lower limb. This is the venous system of the lower limb, occluding the area in such a way that blood does not flow nicely. In such instances, most of the time, we have one-sided swelling, that is one leg swelling, and there's pain and tenderness over the calf area. The calf is masquembe, and warmth over the affected area as well. So when this clot breaks off from the limb or from the area in which it is in the lower limb and goes to the lungs and causes occlusion at the lung area, whereby the blood flowing process around the lung area is affected, then we get pulmonary embolism, okay, which presents with difficulty in breathing, shortness of breath. There could also be cough. So getting this can be precipitated by a number of risk factors, which are surgery, immobility, there being presence of cancers, also use of oral contraception, states that increase the risk of clot forming like pregnancy and obesity, smoking, blood disorders, and many, many more. So when you have a situation whereby we have DVT, deep venous thrombosis, the diagnosis of these two bits of venous thromboembolism is normally made with imaging, which can be a Doppler ultrasound or a CT angiogram of the chest, and also a blood test to test for something we call D-dimers. And the good thing about this whole situation is that they can be well managed either by removing the clot or opting for medical management depending on the severity of the situation.